We're here today with Dr. Hind Hantosh, our consultant internal medicine here at Saudi German Hospital, Dubai as well. Dr. Hind has over 11 years experience in diabetes, endocrine and liver diseases. Please feel free to drop your comments in the section below and we'll be more than happy to answer them as we go along. Good afternoon, doctor. Thank you so much for joining us. How are you this afternoon?
Good afternoon. Thank you. I'm fine.
Good. So doctor, before we begin, would you like to tell our viewers a little bit more about yourself?
Yes. My name is Hind Hantosh. I am internal medicine consultant. I have been working in Saudi German Hospital since 3.5 years back.
Right, beautiful. So today's topic is insulin resistance and diabetes. Now, just to let our viewers know, today is actually World Diabetes Day. So in aid of that, we've actually held discussions to educate our viewers a little bit more about diabetes and insulin resistance. So doctor, let's jump in and start. What is insulin resistance?
Yes. First, thank you for being here today, talking about insulin resistance and diabetes and World Diabetes Day. Let's start define what's the mean insulin. Insulin is a hormone that's producing from the pancreas that taking care of our blood glucose for taking up, utilizing the glucose and give us energy. So what happened in the insulin resistance is the failure of our target organ, muscles, cells, liver to respond to this normally action of the insulin.
Right, okay. So, doctor, what are the symptoms of insulin resistance?
See, the symptom for insulin resistance, there is no specific symptoms for that, but it can be general fatigue, weakness, feeling hungry, weight gain, and also it can be going to the toilet a lot, feeling thirsty, but there is no specific symptoms for the insulin resistance.
Right, okay. And doctor, what causes insulin resistance?
Yes, there is many factors that affect our insulin production and can cause this insulin resistance. It can be genetic factors, it can be the age, it can be acquired factors like sedentary life, excessive eating, lifestyle, also stress. Also, if the people have any history for diabetes or insulin resistance in the family.
Okay, so doctor, with mentioning all the causes and the symptoms, obviously, what are the risk factors that are associated with insulin resistance?
Yes. What we can see from the risk factors, the people who is not doing exercise, who have sedentary life, who is excessive eating of the carbohydrates, sugars, processed food, weight gain, obesity is one of the most common causes of insulin resistance.
Right.
Stress also can be the causes for insulin resistance.
Okay. So, doctor, can insulin resistance actually be prevented or avoided?
Sure. Fortunately, it can be avoided and it can be prevented. How to avoid insulin resistance? By doing exercise, by change the lifestyle, following healthy style, eating a lot of fruits, vegetables, drink well, sleep well is also very important. And once we feel that our weight is not going to be controlled, weight gain, or we know that we have the risk factors for insulin resistance, we need to consult the doctor to find how we can prevent it.
Right.
Sure, there is many ways to see and calculate the insulin sensitivity in your body. We have some to calculate the fasting sugar, fasting insulin, calculate HOMA test, which is very famous now. All the people coming to the hospital want to know their insulin resistance, which is very famous. We do the HOMA test, and depend on that, we can give the tips to the patient how to be cured from the insulin resistance. But
Right.
Generally, to prevent it, it's the healthy lifestyle and doing the exercises.
Right, okay. So, doctor, now with the mention of this, you said, now if a casual patient comes in with certain concerns of being obese and, certain concerns, obviously, they come see you for a visit, how do you go about diagnosing a patient for insulin resistance?
Yes. First of all, many patients coming with general weakness, fatigue, weight gain. They try many diets. They cannot lose weight. Also, we see that the blood pressure is on the border. It's not really hypertension, but is on the border to be hypertensive. Cholesterol level is a bit high.
Okay.
They have all the signs and symptoms for metabolic disease. Metabolic disease, which also increase the risk for insulin resistance.
Okay.
So we can also advise patients to do this with insulin resistance test to check their fasting sugar, to check if they are diabetic or pre-diabetic.
Okay.
Because some all knows that insulin resistance it can lead to the diabetes.
Right,
And
so there is a relation between insulin resistance and diabetes.
Yeah.
So what is are they closely connected, or is there a certain reason why you go from insulin resistance to diabetes?
Yes. First, let us know that diabetes is the condition when the blood sugar is become very high in the body.
Right.
And there is two kinds of diabetes. We have diabetes type 1, which is a hereditary disorder when we have antibodies that working against your pancreas, so they don't produce enough insulin. So we have insulin deficiency in type 1 diabetes.
Okay.
And this one is totally different from type 2 diabetes. Type 2 diabetes, you have a kind of insulin resistance. So your pancreas is working, producing the insulin,
Right.
but your cells or target organ not responding for that insulin. So it is a condition is closely connected to the insulin resistance. So insulin resistance, if it is not avoided, is not prevented, we don't do anything about that, which will continue to be pre-diabetes or diabetes.
Right. Okay. So with insulin resistance, doctor, how do you go about treating it? Say that you do have a patient that's come in and it's a positive find for insulin resistance. How do you go about it? Does it differ from case to case usually, or is it standard treatment?
Yes.
Like,
It is different from case to case.
Okay.
There is depend also on the test.
okay.
We mentioned before about this HOMA test, how it is if it's very high or it is on the borderline. This is first. Second, if it's male or female. About also the BMI, how much the obesity. We should define also the obesity, the patient morbid obesity, normal obese. And also that in general, the treatment is very easy. It is the diet and exercise and change the lifestyle. This is the very easy and it's very important. And to avoid the processed food, avoid the fast food, the saturated fat and the carbs. And also there is a treatment, metformin, glucophage. It's a very famous medication. We use it long time back for the insulin resistance related to the polycystic ovarian syndrome.
Okay.
And now we can also use it for the insulin resistance to prevent patient to get diabetes. We can use it in the pre-diabetes, also to regulate the blood sugar and to increase the insulin sensitivity in the body.
Right. Okay. So, doctor, now you've mentioned pre-diabetes, type 1, type 2. You've also told us a little bit about what diabetes actually is. So, now with the types and the symptoms, are they different from insulin resistance as well as diabetes? For diabetes, if I asked you what are the symptoms, is it different?
Yes.
From
Yes. For diabetes, we have specific symptoms that the patient is losing. Also, it is different from type 1 to type 2.
Right.
We will concentrate mainly on type 2 diabetes today because we are connecting insulin resistance with type 2 diabetes. With the type 2 diabetes, the symptom is thirsty, feeling hungry, weight gain, edema, generalized weakness. So all these symptoms, it's related because of this insulin resistance in the body. High cholesterol level, high blood pressure, all these are connected because what happened in insulin resistance, it increase our triglycerides, increase our cholesterol, increase the BMI because the people become obese, and at the end all lead to the increase the heart diseases and atherosclerosis, so which
Right.
is become a very high risk for the heart problem in the future.
Right. Okay.
For type 1 diabetes, it is the symptoms is a bit different because type 1 diabetes coming early in the life, and it's more aggressive symptoms with weight loss, excessive thirsty, excessive urination, excessive dizziness, drowsy. So it's more aggressive symptoms.
All right. So it sounds aggressive. So I'm actually learning something today. So, doctor, does the insulin resistance, it always leads to diabetes, or it can be stopped with the treatment that you
I
provide?
mentioned before, fortunately we can stop it.
Okay.
So we have many patients who have insulin resistance, and many patients also have pre-diabetes. But once they start change their lifestyle, do the exercise, sometimes with the help of medication, we can stop it and return back to the normal.
Okay, so doctor, what are the risk factors with diabetes on its own?
Yes, some all knows that diabetes is a chronic disease and it can cause many complications in our body. Any patient have diabetes after 5 to 10 years, they develop kidney disease, they develop heart disease, it can affect our eyes also. So it is a chronic progressive disease. So we need also to educate our patient about diabetes to stop. It's not only because they feel good now, we should educate them about the future and the complications of the diabetes, because it is a chronic progressive disease, can affect the kidney, can affect the eyes, it can affect the artery, vein, and the heart.
And you did mention it is hereditary.
Some I mentioned, it depends on the type of diabetes. If it is type 1, it can be hereditary. Type 2, it's mainly related to the lifestyle, diet, and overweight and sedentary life.
Right, okay. So doctor, how does diabetes as well as insulin resistance, so that two separate topics I know, but we're just going to try and combine it. Now, how does diabetes affect the day-to-day lifestyle? Is it just the excessive urination, or just fatigue, and you mentioned the home test. So when you say home test, is that the...
It is not home test, it's HOMA test.
HOMA test, okay.
Test
So it's
hemostatic model test, we use it.
And that's a blood test.
It's a blood test. We calculate the fasting sugar, we calculate the fasting insulin, then we calculate what is called is HOMA test to see if it is they have insulin resistance or no. And there is a specific reference number. We follow up till 2, it's normal, over it will be insulin resistance, and we have mild, moderate, and severe.
Right, okay. So how does it affect the day-to-day lifestyle of a patient excessively?
Yeah, what we are facing in our life, in any work life, we see that the patient mainly coming because of general weakness, weight gain, difficulty to lose weight. So this is the most problem.
Okay, so okay. So now I just want to know. I know someone that is absolutely not obese, not morbid obese, very, very skinny, and also says that he is diabetic. Now, is that a possibility? It doesn't necessarily mean that you're overweight, that you are diabetic. You can also have diabetes if you are underweight or fairly active as well.
Yeah. This is according to type 1 diabetes.
Right.
Yeah, it can be.
Okay.
Because of hereditary. So it's not related to the weight, it's not related to the diet, it's not related to these things. It's related to the hereditary or the genetic, because they have antibodies in the body that work against the pancreas. So the pancreas is not working adequately, so they have deficiency in the pancreas and the insulin.
Oh, okay, all right. So, doctor, is there an age category that's specific for insulin resistance as well as diabetes, ideally?
There is no age specific. It can start from 20 plus, but also what we see nowadays, the type 1 diabetes, they have also insulin resistance.
And children can also be affected by this?
Yeah, children also can be affected because of the obesity, because the main cause for the insulin resistance is the obesity and the wrong lifestyle, the diet, the sedentary life, all the kids sitting in front of the iPads, and they don't do too much activity, processed food, fast food. So all these are the same risk factor for the insulin resistance.
Right.
So they are more risk to get diabetes in future.
Okay, so for even if mom and dad is healthy and the child is obviously leading a bit of inactivity, incorrect food intake, we'll say that's not a healthy portion of fruits and vegetables, and it's just McDonald's, we'll say it's probably a high risk situation. Thank you so much, doctor. Is there anything else that you would actually like to add to our viewers with regards to insulin and diabetes, considering World Diabetes Day is today? We do have a lot of patients that are curious. I know we received a question actually before you came on. The discussion today was about pre-diabetes, and I think they were at a level of 5.5 or 5.6 reading, and they're known to be pre-diabetic, but they're being treated as they are diabetic. Now, is that common, or is that something that can be reversed?
Yeah.
Can it be cured?
Yeah, it's very important to discuss these results with your doctor. So because it's like stages. We have this insulin resistance. If it is not treated, it will become pre-diabetes. Then if it's not treated, it will become diabetes. So this is like
Stages.
Stages. So for insulin resistance, I mentioned before, we take this fasting sugar, fasting insulin, calculate HUMA, but usually we take also the HbA1c, which is calculating the sugar the last 3 months to see if you are diabetic or pre-diabetic. Pre-diabetic means that the HbA1c become to be impaired, to be a bit higher than normal, but not to the level that we define it as the diabetes. So in the step with pre-diabetes or insulin resistance, we can work on that. But once it is a diabetes, I mentioned before, it's a chronic progressive disease,
Right.
so we cannot reverse it.
So it'll be lifelong in terms of treatment
For diabetes.
being chronic. Okay. And doctor, one more question that we did also receive. It is a heavy topic, I would assume. So I mean, we did receive a few demands with this. Was having diabetes, chronic diabetes, type 1, type 2, or insulin resistance, is it a high risk for pregnancy?
High risk for pregnancy.
Pregnancy or infertility?
For infertility, yes, but it's not high risk for pregnancy, because most of the ladies who is difficult to conceive or to be pregnant, they have either polycystic ovary syndrome, which is associated with insulin resistance,
Right.
which make the pregnancy is difficult.
Okay.
So it is a risk for to be infertility, is not for
not for high risk for pregnancy.
No.
So it's for infertility. All right, great. Doctor, I think that about sums up all the questions that we actually have for you today. Before we end, however, would you like to share any tips that you would like to our viewers this afternoon?
Yes, because of World Diabetes Day, the simple tips I give to all my patients is to do the exercise regularly and to eat healthy.
Right. Thank you so much. So thank you, Dr. Hind. Once again, your time spent with us this afternoon is much appreciated. I know I have managed to steal you out of a very busy clinic, so thank you. I hope we have answered all of our viewers' interests and concerns here today. Thank you so much for watching. Once again, we have with us Dr. Hind Hantosh. Sorry, doctor, my apologies. You can call us for 800-221 for appointments. May you all have a pleasant day ahead. Thank you so much for watching. Stay safe. Thank you.